So basically, I am admin of the psoriasis group in this Telegram channel. So we have a group, a family of psoriasis people, like around 350 persons in this group.
Okay.
So all are suffering from the psoriasis since around 10 to 12 years, and different age group is there. So I humbly thanks Dr. Baswaraj to give us opportunity to explore this wonderful therapy. And I also experienced the therapy in the past for the joint pains, and this therapy like works like a magic. So definitely, we hope for a good this thing consultation session for this thing psoriasis. So I once again welcome Dr. Baswaraj for this wonderful opportunity, and thanks a lot, sir.
Thank you very much for welcoming us, sir. Thank you. We'll start, sir, within 2 minutes. Chat box is on throughout the session. So if you have any questions or anything else, you can just express your words in the chat box.
Yeah, sure, sir.
Prabha. Alright. So what's the reason is liver and kidney insufficiency?
Well, welcome back. So please confirm whether my voice is clear or not.
Little more voice is needed.
Still more voice. Okay.
Now okay.
Now fine. Okay. Thank you.
Now fine.
Sure. So welcome you all for the psoriasis discussion. So we'll discuss one by one regarding food and lifestyle and other perspective of this one. So before that, before going for so treatment suggestions and as well as some other aspects of this one, first we will see how our ancient diagnosis treatments they're looking into this perspective. So what is psoriasis and what may be the root cause? Is there any particular way to handle it? And is there any protocols to treat this? And what are all the food it will helps you? So all those things. It is a series of session. Okay. So definitely. So in upcoming weeks, we will add a few more sessions. And this is a beginning. So definitely, I hope this will make you to understand better. So this entire session is completely based on the what we experienced with our clients and how they are today now. And I want to quote one simple example before starting this. So in 2000, I think 13 or 14, 7-8 years back. So one young girl around 22, 21, 22 years age, she came to me, to my clinic one fine evening, saying that, "Doctor, do something. One of my friend given reference to you. I can't wear my dresses. Whole body as suffering with psoriasis, and something, is it possible? I'm since 7-8 years I'm taking a lot of medications, ointments, nothing is helping out." So we just started treatment within a year. So we can say 90% of our eruptions and the skin itching and other things is completely eradicated. And how best she is now means she's a model now. Okay. So if she permits, I will share pictures today or tomorrow. So don't think this disease will stay lifelong and it won't makes you comfortable, and it is keep on disturbing you. It's not like that. You can completely suppress all the symptoms and you can keep it in the one corner of your life, and it never ever disturbs you. But the approach towards is very, very important. Don't see it as only a skin. Okay. And this is making some rashes or some dryness or something else. It's not like that. This completely, you should look the each and every cell of you as a whole. The skin is one of the best languages to understand about you. How we are learning the languages: English, Hindi, Kannada, Telugu, Tamil. We have different languages to understand our communication. Similarly, as a TCM practitioner, as a practitioner of Basava therapy, I strongly believe skin is one of the easiest language to learn and to understand about the body and mind. At the same time, you can treat holistically without any medicines. So let's see what is psoriasis, how we can go about it. Mainly, TCM perspective, traditional Chinese medicine way, most of the psoriasis, it starts with it's a small red papules initially. Am I right? So it's more experienced healers are there here. You can share your view. So it's welcome. Most of the time, we see it as a start either in the legs, inside of your legs, sometimes on the head, on the skin or palm. It's somewhere it will start. The beginning of this, it's most of the times it start with the red papules. So the moment you say red papules, what doctor will say? So most of the doctor perspective of this is they go with the modern science perspective is like that. They will say it's a maybe inflammation of the bed or some external things. But according to Ayurveda, it's clearly said that It's the aggravation of pitta in the body. In TCM, we say it as a blood heat. So blood heat So I'm just sharing weight. I think all TM students are here. So in TCM, we will tell it as it's a blood heat, which causes rashes or red scales or red papillae on the skin. So what may be the cause of this? How the heat which induces into the blood. If you say to any doctors, there is a heat in the blood, there is a heat in the body, no doctor will believe this. They laugh at you. Because according to doctor, if temperature rises more than 99.4, then only it is a 98.4, then only it is a heat. So all the psoriasis patient, just you can touch the near person with your palm. Just touch the other hand, other person palm. You can feel the difference in the heat. Are you feeling cold or heat? You can yourself, you can test and try. Just touch your palm. Just make a touch. Who are there near to you, just make a touch. You're feeling heat or cold. You're feeling heat or cold, just text me in the chat box. So most of you having a skin eruptions or red scales, it will be heat. And only 10% of the people, they feel cold, because in the long way of your journey, the continuous indeficiency, it also makes the yang deficiency. Because heat is there for 10 years, 12 years in the body, means that heat which is also decreasing, the indeficiency, in means it's a heat. The indeficiency, it is making you the yang deficiency. Means in means nourishment. If the nourishment to the organ or to the skin, it is not there for more than few years, that converts into yang deficiency. Yang deficiency means unable to function completely up to the its what we call to the its performance high level. So here, as texted in the chat box, 90% of the people, they are feeling heat and hotness. So that means there is a deficiency of the fluids in the body that is rising heat. Heat means it is not temperature. It is a amount of fire in the body. When you have more number of fluids and better functionality of the body, both heat and coldness is balanced. When your body fluids will go down due to deficiency of the intake or something else, the heat will rise up. One of the reason for blood heat is the strong emotions. What are all the strong emotions which we feel? It may be any emotions. Too much anxiety and fear, too much stressful, too much desireful, and too much restlessness, and late night sleeps. For today's generation, there is no particular work to sleep at 12 o'clock or 1 o'clock. Simply they wake up. They're supposed to sleep by 9:30, but they will sleep at 12:30, 1 o'clock. If you ask, is there any project? Is there any work? They say, not searching like that. Simply I sleep late. What they do? They're simply browsing the social media, some unwanted newses, all those things. Whenever you sleep late, so that is making you in deficiency or heat in the body. Remember this. For young deficiency people, sleeping late itself is a good. But today's generation, due to processed food and hybrid foods, we are all into indeficiency. If you have an indeficiency, better to go to bed within 9:30, 10 o'clock. Max to the max 10, 15. Don't delay above it, because the entire nature is taking rest and regenerating itself for tomorrow's action, for tomorrow's function. If you are not yourself not making regeneration and restful, so at the same time, we are not reducing our functionality of the tomorrow, because we are all, most of us are employees or workers or some self-employees are there, but we have commitments. We cannot stop our work. So we are not all stopping our actions, but we are stopping our resting. So over the period of few months or few years, our body fluids will go down. So that induces the blood heat in the body. The second most important thing is food. The food which you are eating today, it's a maximum, it's a refined. The refined food making you a deficiency of the nutritions. You should take the food as a wholesome. Not like that. You're taking only egg white, or you're taking only egg yellow, like that. Many people. So you should take each and every food should be naturally processed, and it should not be separated or refined or something else. So that will induce heat in the body. And second most important thing, we are all using more and more spices in every day. You yourself, you can make experiment. Okay, whenever you are making your skin aggravation, just stop your all the spices for 2 to 3 weeks. You can see the more improvement, because most of the spices, they are increasing the blood heat. Okay, when blood induces in the, when heat induces in the blood, and it is always trying to escape from the blood. How it will escape? Either heat has to escape by bleeding. Many people who are having excess bleeding, either they do nose bleeding or anal bleeding or menses bleeding. Why? Because there is a excess heat. The excess heat from the blood, it is getting out through bleeding. If not through bleeding, what is the next option? To go escape from the blood. The next option is skin eruptions or gum bleeding. Or else you can see through urinal burning, anal burning, eye burning sensation, or air fall. Finally, skin eruption is a one. Why? Because the heat is stagnated in the blood and it is trying to come out. So that's what, to let the blood heat, there is a one technique in TCM. There's a special needles are coming for bloodletting. You can just Google it. So bloodletting acupuncture needles. So where there is the skin eruptions, we do some bloodletting through those needles. By doing that, by reducing the blood heat, or we also reduce the blood heat by pinking on the tip of the fingers. Okay. We do that also. Tip of the fingers, ear apex, in many areas we do bloodletting. By doing this, we are just eliminating the present blood heat from the body. But it is not sufficient to heal wrong run. At the same time, you should change your emotions and food. These two are very important role in your skin manipulation and skin health, or to maintain the humidity in the skin or moisture in the skin. By calming your mind and as well as you can choose some food which cools the blood. And third most important thing to reduce your blood heat, you can adapt some of the pranayamas, especially breathing through left nostril. It will cool your body and as well as blood. How to change emotions? Very good question, Preeti. What may be the things you do? It's very simple. Most of us, we are running with the young mind. Young emotions will be there. How we are inducing strong emotions? That's what I made that as a first, this one. Most of us, we are running with Just a minute. There is a camera error will be there. ಒಂದು ರೌಂಡ್ ಹೊರಗೆ ಹೋಗ್ಬಲ್ಲೆ. ಹಲೋ, ವೆಲ್ಕಮ್ ಬ್ಯಾಕ್. Hello. My voice is clear, Fido?
Yes, sir, clear.
So one of our student asking, what is things we can do with emotions? The first thing, you don't need to change many things. Okay, just yourself. Don't compare with the near ones. That's it. That is where you are run our mind. When you compare with others, okay, he did this, I did this, and she did this, I did this. So that makes you to run in the real life. So try to avoid it. Definitely your mind within few weeks, it will slow by more than 70%. That's the first thing you need to do. Because most of us, not only in the elders, we are seeing this skin diseases even in the children's. Because we started giving grades even from the LKG, UKG. So we are running towards the grades, and we want to see ourselves at the top, and you want to see at the front. When we do this, automatically we end up with some excessive emotions, some anger, frustration, irritation, and restlessness. It's all young energy. So the moment you say from my side or myself, I am the one, I do this and all. The moment you say I did this because of me, it is running all those things, automatically it induces the young energy in the body. To induce body heat, you no need to run for 10 kilometers. You no need to run for 10,000 steps. Just your emotions are enough to make yourself into blood heat in the body. So that's what the first emotions you can include towards healing is just lead your life without comparison. Maybe this is quite difficult, but not impossible. Am I right? This is where, because I personally inquire many of patients, when you got this, how it is done. Most of us, before any skin changes, if you see them few months or few years, either they are into the some emotional imbalance or some breakups or some deep into the worries or some other stress they may into knowingly or unknowingly. Because according to TCM, the color itself shows. The red color, it indicates the heat. The beginning of your skin, it's maybe it's 90% it's a red. Then it turns to the white and scales, black scales, and all other things. So that's what the first step towards healing with psoriasis is very easy and simple. It is not hereditary. Maybe from the hereditary, you may getting the constitution. For example, your body, your mother or father may have a wind or heat constitution or pitta constitution. Due to that, you are getting pitta constitution. That is hereditary. But pitta aggravation is not hereditary. That is, pitta aggravation is you inducing. You got the pitta constitution from your father or mother. That is hereditary. But pitta aggravation, it is a vikruti. That vikruti you induced through your mind or through your actions. So that's what, if you want to make yourself healing towards psoriasis, the first step is your mind. The next step is food and point or something else. So Vijay Kumar is asking very nice question. How about the very small baby? How we can see the emotions in that? What is the age of the baby, sir? What is the age of the baby? So if it is happening below 6-7 years, here it may not be due to emotions. It's maybe the main culprit is here food. So if it is happening in 3 years, 4 years baby, means definitely 80% of cause is through food. From the womb, we started giving a refined food. What is refined? The food doesn't have essence in it. That is refined. We are removing the fat from the oil. We are removing the essential nutrition from the grains. We are removing fibers from the grains. So many things. So skin needs a moisture content. Skin needs oily content. Skin needs essential food, the moisture in it. The moment you give refined milk, means pasteurized milk, removed fat in it, and we are giving oil by removing the fat content in it, and we are giving the grains by removing the upper layer in it. If you do this, automatically the essence will go down. Bone won't grow properly. The bone density will go down. Even early ages, people are inducing with osteoporosis. So automatically, if you don't have enough quality fluids in the body, your body fluids, they are unable to nourish your skin. This is the root cause of your skin eruptions which happened in the 3 years baby. Got it? If this happened after 15-20 years, definitely there is a rule of emotions. But if it happened too early, at the age of 3 years, 4 years, 7, 8 years, here the rule of food is not much. Sorry, rule of emotions. Then what? Definitely it is a food. Food is a culprit. You check it out, the what food you are giving to your baby. In that, 80% of the food ingredients which we are giving are refined, are processed. So that's what the first step when it is happening in the kids. You should take care of food. Even mother food also, mother emotions also we are inducing into the baby. Oh, we tell a baby like our father or mother. We are inducing. In the first year, when mother is doing breastfeeding, our grandmothers used to tell, hey, don't heat that food. It causes burning sensation for the baby. Don't heat that heat food. It will make urine infection to the baby. Because what mother heats directly, I'm telling, not telling about the nutrients, I'm telling about the nature of the food. When you give the food which is pitta in nature or in kapha in nature, the same energy it induces into the baby. So that's what the two things you should take care. One is the strong emotions. The other one is food. Especially who's having a burning sensation and damp heat in the body. Try to take any one fruits, especially apart from citrus fruits like orange and all. You can take musambi. One fruit in between 11 o'clock to 2 p.m. Any one fruit. So that induces in energy in the body. If you take native breed, it's good rather than hybrid fruits, or else something is better than nothing. So try to take any one fruits. That will definitely is trying to improve your this one. And afternoon, make a habit of taking buttermilk. Orange is heat and sweet lime is cold. Afternoon, at the end of the lunch, after taking rice, dal and all, by end you take some buttermilk mixed with rice. So that also makes reduces heat. And 2-3 slices of cucumber along with your lunch also induces very good cold energy. If you are having very good digestion, you can take curd by adding little water into it. If you are weak digestion, avoid curd. So curd and milk takes a little more energy to digest. But milk and curd is excellent in food that induces in energy in the body. But only thing is, if you are not digesting it, again it becomes a dampness in the body. If you are able to digest it, you can take. Clear? And at the same time, try to avoid the soft and hard drinks. All are inducing the damp heat in the blood, because most of the soft drinks they come with pesticides contents in it. So indirectly, the pesticide contains what we are using as a preservatives. So that increases your blood heat. So ashwagandha also increasing blood heat. Lemon juice also increasing the heat in the body. But lime juice, sweet lime juice is an excellent cooler. By taking 2-3 days continuously, you can see the coldness in the throat and nose block and all. But if you take lemon, it is reducing body fluids and increasing the heat. So how we can clear? Chiku is cold only. If you are too much blood heat is there, skin rashes, itching, and some burning sensation is there, you can make some bloodletting from your tip of the fingers. So that is one of the excellent way. And also you can take some of the best cold foods along with the dairy and fruits and vegetables, and do some pranayama. And you can take some tender coconut, that too in the afternoon, and check it out your tongue. Definitely the tongue will be little red in the tip as well as in the sides. That is indicating the damp, there is a heat in the blood. There may be some purple dots. Ice cream is absolutely cold only, but after eating ice cream, few of you maybe see some body warmness. That is a counteraction from the body. When you give too much cold food, body is try to increase the body heat. So that is a counteraction. So bloodletting you can do from the any tip of the fingers. The thing is, mainly it is to eliminate the blood heat, just to make some pathway. Not only sugar or milk, any food which is having refined, it will increases the psoriasis. Refined, I'm mentioning this one, please note it. The moment you refine it, remove some content of the food, automatically it is making you deficiency of the fluids in the body. That deficiency of the fluids will rise the blood heat. You understood, Ravi? After eating sugar, after eating milk, why the psoriasis aggravates means because the food which you took, it is a refined one. And the one of the best way of reducing blood heat is sit some time of the day without doing anything. Sit some part of time of the day without thinking about the future, without making any plans. Just relax. Got it? I'm not telling you to avoid the thoughts. I'm telling you, don't do plan or anything. If meditation is possible, you do it. But meditation is one step ahead from normal people. We can do it later. But before that, just some part of the time, just relax without thinking about the past and future, but just seeing what it's visible to in front of you. Just relax, just sit idle. Just idle, nothing else. In this ideal period, you no need to avoid any thoughts. You just be idle, that's it. Here, you no need to avoid anything. Yes. No. Sleeping also increasing the in energy. Meditation, sitting idle, or all are increasing the in energy. And one more thing is, so many plants reduces the in energy. Our refined food is reducing in energy. Similarly, too many plants. Yeah, you can go sleep, nothing wrong. Yes, Pillai, you can unmute and talk. Yourself, you can unmute and talk.
Hello, sir. Good evening.
Good evening, sir.
Hello.
Yeah, your voice is audible.
Sir, one of the family here, very near to me. Now, two ladies are there. One man. They are children of parents. All the three are having this skin eruptions, psoriasis. They have taken many medicines, allopathy, Ayurveda, Unani, etc. But till date, they have not recovered, and the scaling is there, and the redness is also there, sir. Now the lady, the elder lady is now 35. The brother is 30, and another sister is also there. She is around 28.
So I think you are present batch of TM student, sir.
Yes, sir. Yes, sir.
So I will help you to treat these cases. Okay. Instead of giving money, something else, if you give some good result, that will be a great to the people.
Sir.
And
They have spent, sir.
It's not about the money, it's about the passion towards healing.
Right, sir.
Start treatment right now.
Sir. Sir.
Okay. Let's start treatment by for all three of them. You do LI11 sedation.
L11 sedation, sir.
Okay.
Sir.
And also tell them to sit 1 hour idle in a day, any time of the day, and one fruit in the afternoon.
Sir.
Plus try to avoid refined foods.
Right, sir.
Okay. So within 3 to 6 months, you can give 80% relief, sir. Sure.
Hello.
Then 3 to 6 months.
They are very poor family, sir. Sir, they are
Don't worry, sir. You don't charge them also.
also to afford the treatment. So they are simply, sir, so that we can help them, then it will be very nice, sir.
Keep them. Don't charge also. Okay.
No, sir. Sir.
So you start treatment after 1 week. You just please update in the group.
Let me know, sir. Right, sir. Thank you, sir.
Thank you. Hello. Yes, Vijay Kumar. What is your experience? Your writing? You can talk.
Yes, sir.
Yeah.
I had a couple of weeks back. There was for no reason there was a bleeding in my when I went for pass for before starting motion itself. For no reason, and I was alarmed. Then somehow, of course, I'm under your treatment subsequently later on. But initially, I just tried to cool my system with taking some cold food and vitamin B12. and that subsided very much. And thanks a lot for your what do you call making us understand the purpose, the what do you call the um, importance of yin, taking cold food and trying to be cool. In fact, I was very much disturbed also at that time. Probably even that added up to my problem or what, I don't know.
Okay. So then you subsidize with food and vitamin B12
Yeah,
supplement.
B12, yes, sir.
So if you take the raw food or unrefined food, vitamin B12 will come naturally. You try to substitute that.
Right, sir. And the thing is, I have a very severe acidity problem for many chronically. Anyway, now I'm under your treatment. Before earlier, I've been taking a lot of this pantoprazole and other things, which ultimately led to this B12 deficiency in my system.
Okay.
So that is one of the causes of my bleeding, I suppose, and my weight loss and other.
All your symptoms are insufficiency only. It may take few months, so definitely you'll come out of it.
I'll wait patiently, sir, very much, sir. And sir, so what about this lipoma also part of this yin deficiency only, sir?
So along with insufficiency, there is a liver stagnation. Your body blood conductivity will be very poor.
Okay.
We can make it parallel. Yes. If anybody asks in particular treatment, you can share, you can talk. Raw food, it's not everyone's choice. We should take before taking raw food, we should check whether there is any yang deficiency in the body. If there is a spleen yang deficiency, people should not take the raw food. Yes, Girija.
Sir, good evening. Sir, my friend, she's a Sri Lankan, but staying at Kodaikanal next to my property. And she has got this black patches behind the blouse, back area. Yeah. And in the arms. Her father is psoriasis patient and he was cured with a native medicine at Sri Lanka. She always tells me that.
Okay.
And I have seen very bad cracks on the heels, sir.
Okay.
This is, very bad. She's going to Madurai for treatment and she's on steroids. Her mood is so erratic now. She's around 80 years, but very smart lady. 80 years, she's an industrialist.
Okay.
She doesn't look, tired or she can do 10 months work. She's that kind of a character.
Okay. That means the fruit, food cracks itself is telling there is a insufficiency in the body. Lung insufficiency.
Yeah.
Start treatment by LU7 tonification. You can see the great results.
I'll do that, sir.
Sure. Thank you.
Thank you very much, sir.
Thank you. You can take fermented jellies.
Yeah.
Yes,
sir, can I ask something?
Yeah, sure.
Yeah. Sir, actually, I have soap allergy.
Okay.
So, if you can see my fingers, so it is because once I touch Vim or any kind of dishwasher, so by mistake also it is touched, then I get cracks and it takes almost 20 days to heal, whatever treatment I give. So
yeah.
This is
definitely it is due to, can you show that your skin rashes?
Yeah.
Just a minute.
So this crack has healed. I was applying that Sujok and points on the skin meridian.
The skin eruptions is clearly showing that there is a cracks, dryness in the skin.
Yes, sir.
Yeah. You just do one thing. You just apply sky blue dot on the left hand small finger yang brain.
Okay, sir.
Okay. Just apply 1 or 2 weeks. It will clear and your allergy will also come down.
Okay. And I have kind of dryness throughout the body. And since very long time, maybe 20 years or so, I've been using some or the other lotion.
Don't worry. That's what I given a color therapy to reduce the entire body dryness.
Okay, sir. So fine, sir. Thank you, sir.
Thank you very much.
Sir,
Yeah,
urticaria is also indeficiency.
yeah, definitely.
So same treatment, same precautions are there.
Yeah, exactly. But sometimes around 25% of the people, they are also having some dampness in the body. Too much of dampness, it makes the body is unable to absorb the water. So that also makes urticaria. You need to check the tongue and other symptoms. You come to know. If there is
My
a
daughter-in-law is also pitta problem, and also just shown finger just now. This lady dryness and cracks on the fingers. Same position.
so definitely you can give indeficiency points. If they are not responding, you can go for dampness. Okay.
Sir, is it possible those who are having young excess, but when we check the pulse manually, they are having very less pulse, dull pulse.
That is possible, madam. Okay, yeah, because aged people and who's having yin and yang deficiency, so they will have both.
Okay, but all the symptoms are excess, but
then you consider as a yang only.
Okay.
Okay.
Hello.
Yes.
Okay.
Can I talk?
Yes.
Sir, my daughter is a physiotherapist. She is an aqua physiotherapist. She does treat her patient in the swimming pool like that for last 3-4 years. Nowadays, she is after coming out now, though it is a well maintained, well hygienic. Nowadays, she is finding skin problems or the erections are coming.
After practice,
because she is throughout the day treat the patient in the clinic, cleaning the water only for almost 4 to 8 hours, 6 hours. Of course, she comes out in between, but she treat the patient for session about 40 minutes, something like that. And nowadays, now after 3 years, now she's finding little bit of skin problems. Are there a lot of heat is there?
You do one thing, sir, because skin warmness is controlled by lung energy.
Yeah.
So lung is responsible for opening and closing of the skin pores.
Okay.
Because of too much coldness, it is exposed by the skin. If the lung is unable to warm the skin.
Yeah.
Okay. So that's what you can do. One thing below the thumb, okay, on the lung reflex, just apply little heat or warm blood, warm things like you can apply Jendu balm.
Acha. Okay.
In this area.
Okay. Okay.
Or you can apply little ginger liquid in this area.
Okay.
After crunching ginger, you will get that fluid, no?
Yeah.
Just apply it for few minutes or hour. So you just practice this for few weeks. You can see the great improvement, warming of your skin.
But it is not a cold water. It is a temperature control. It is temperature control.
Okay. So that is what your body warmness, it exactly maintained to 37 degrees Celsius.
Exactly.
Okay.
Yeah.
So your water may be high or low.
Yeah.
To the skin. So then your lung has to work more.
Exactly. Yeah.
So lung function can be increased with many ways. One of the simplest ways by warming this area.
Okay. Thank you.
Thank you.
Thank you, sir.
Thank you.
Good evening, sir.
Good evening.
I have these questions. In many patients have mixed type of psoriasis, damp heat on the scalp, and in the same time, cold, damp coldness on the chest area, like psoriasis guttate. What we can do if we have two type of psoriasis together, damp heat and damp coldness?
Yeah, we can treat, don't worry. First, touch the patient palm.
Okay.
Okay. What do you feel initially? It is a cold or heat or wetness.
Okay.
Okay. Based upon that, you start your treatment.
Okay, sir. Thank you. Thank you very much.
Good evening, sir. Seema here.
Yeah, good evening, Seema.
I came across a lady, she's 40 years old. Some 4 days ago, sir, suddenly her lower part, there was very red, big eruptions, and then it changed into boil, and then after that, immediately it changed to black all over her vagina, her anal area. I mean, it was burning. It was very painful, and now it is not whole body, especially inner thighs, vaginal area, and anus backside.
You do one thing, madam. You are a TM student, no?
Yes, sir.
Okay. So tomorrow she is visiting to you.
No, she is one of my relative. I just wanted to understand what is this, sir, actually.
Definitely. This, to the lower abdomen, the body heat and dampness is controlled by the spleen.
Okay.
The spleen dampness is very low.
Okay.
So that is what she is getting all the eruptions and the burning and all.
Okay.
So to relieve immediately, the spleen, whether is small intestine, SI5 sedation, you do it.
SI5 sedation. Okay. I mean, like she's not able to move, sir, and very painful for last 4 to 5 days.
That's what. Immediately you do SI5 sedation, you can see the great relief. After 2 or 3 days, you can give SP3 touch.
Okay, sir. Thank you.
Thank you.
Hello, sir.
Yes.
I'm Chandana.
Yeah.
My face is very oily and I have dark circles with wrinkles from the past 20 years. My age is 24. Don't know what's the reason.
Can you switch on the video?
Yes.
You're present best student, no?
No.
No. Okay.
I think I'm under light. It is more visible
Just it's
in
a
daytime.
few seconds. You can just, I'm just
Yeah.
want to check.
Yes.
1 minute. I'll add to spotlight. Okay. Okay. Yes. Got it, madam. Looking at your eyes, it's a liver coldness. Okay.
Okay, sir.
So what you can do means, you know about the Sujok or acupuncture points?
Yes, sir. Yes, sir. I know.
Okay, you do one thing. On the liver, on the Sujok biological meridian, liver to point, you apply methi seed for 10 minutes.
Okay, sir.
Okay.
How many days, sir?
Only 1 day, only 1 time.
Okay, sir. Okay.
Avoid oily food.
Okay, sir.
Okay.
And also, I'm having a blackheads.
Yeah, blackheads, dark circle, and oily skin. All 3 will go off within 3 weeks. Just you, once you do, apply 10 minutes methi seed, only 10 minutes.
Okay, sir. Thank you. Thank you so
Thank you.
much.
Understand? In these 3 weeks, avoid oily food.
Okay, sir. Okay.
Thank you very much.
Yeah.
Good evening.
Good evening.
I'm Premlata, sir.
Yes, madam.
Sir, I'm getting a skin problem also, and cold and cough also, and my this tongue is always cut, and all this from here I'm getting always inside cuts and burning. So whether I should consider it cold and cough or yin or yang?
Yeah, cold and cough means when you are getting cold and cough.
And sir, I am having insomnia problem also. So I did your protocol for insomnia. 2 times I did. 2 times I got very heavy cold and cough.
What point you did?
I did green on finger number 3 and finger number 4.
It is a wet cough or dry cough?
At present, it is wet cough.
Wet cough. Okay. And burning sensation where?
It's after tongue. That is.
सर इनको भी
so
है
many years.
पिछले 30 साल से
Cold cough.
From inside neck.
Inside the neck.
Here.
You just do SI4 sedation, madam.
SI4 sedation.
Yeah, it will clear. Just apply methi seed 10 minutes.
SI4 sedation.
Yeah.
methi seeds.
Yeah,
Oh, I will do, sir. Thank you.
sure. Thank you.
Hello, sir.
Yes, madam.
Suresh Kumar. Suresh Kumar.
Good evening, sir.
Good evening.
Hello.
Anyone? One by one?
Hello, sir. Varsha from Balaghat.
Yes.
My father has psoriasis problem.
Okay.
My mother will show you it on video. Actually, he is suffering from this disease since last 30 years.
Yeah, show me.
He has all over his body.
Okay.
मम्मी आप दिखा सकते हो क्या वीडियो में प्लीज? बड़ी मम्मी.
He's all having black hairs. Spots are there on his cheeks and
Whole face.
whole face. But cheeks are there na. His खड्डे खड्डे होने लगे. चीथ थोड़ी ना है. On cheeks only. And ये लगा मतलब. So black. Whole face is black.
The
Black patches are there.
black patches are indicating.
Oily. And he's having oily skin.
So,
But and also he's going to motion after eating today. अरे त्याच्यात नुसार असते ते पोट खराब असलं की मग ते हे असतं.
पोट खराब नाही तुझ्या मध्ये 3-4 घंटे संडास येते.
अरे तर मग 2-3 टाइम जातं ना सकाळी.
can you talk in English?
दुपारच्या जेवणाखाली.
Can you talk? Yeah, tell me in English.
हेलो सर, मैं
Yeah.
पूछ सकती हूँ?
Yeah.
सर मुझे फेस पर यहाँ पर छोटा सा लम्स है. मुझे बॉडी में बाकी जगह पर भी है, मगर अभी 4-5 साल से फेस पे भी हो गया है. मुझे यहाँ पर है.
Okay. So that is a little lumpy kind of thing, no? It is a damp heat. This is a lump. Yeah. It is a damp heat.
सर ट्रीटमेंट क्या करना है?
It is you have to you know color therapy or acupressure meridian points.
हाँ सर.
Okay, if you know meridian points, it's a damp heat. You just sedate SP6.
SP6 sedate.
Apply one methi seed on SP6 10 minutes.
मेथी सीड
On
कौन से
SP6.
पॉइंट पर?
On SP6. Here is the SP6.
SP6 मेथी सीड और सीडेट.
सर इनको भी
Sedation.
सर बियोल से सीडेट करना है, फिर बाद में मेथी सीड लगाना है.
No. Only apply methi seed, it will sedate it. Okay.
Sir, sorry to interrupt. If you can see the
Sir,
video of
कितने दिन-
Mehul Bothra.
Yes.
Hello.
Yes, yes.
Suresh Kumar.
Hello.
Yes, tell me.
Hello, sir. If you can see the video of Mehul Bothra, he's my father and it's a serious case of psoriasis. He has psoriasis all over his body and he's suffering from psoriasis since last 30 years.
Okay. What are all the symptoms? Burning sensation is there?
Yeah, burning sensation is there. Blood is also coming out of from body. Sometimes pus also comes out.
What is
and
the
sorry.
color of the pus is yellow or white?
बड़ी मम्मी कलर क्या होता है पस का? येलो की व्हाइट? Yellow.
Yellow.
Yeah.
Okay. So there is a damp heat in the body. You can start treatment by sedating liver 3.
Pediatric.
Liver 3 sedation.
Okay.
Apply one methi seed on liver 3 10 minutes.
Okay. Okay. Hello, sir.
Good evening, sir.
Sir,
So it's better to avoid multiple things. You do one thing. You raise the hands and Sir will unmute one by one. Okay.
Suresh Kumar.
Yes. Yes, Sirish.
You are not audible. Suresh Kumar, not audible.
Next. Sudha.
Good evening, sir.
Good evening.
Sir, 14 years girl.
Yes.
She's having a, heavy dryness. I pour coconut oil on her head. It is within 15 minutes. It is dried up, and then she is having black color patch in the backside neck.
Okay.
Then heavy dandruff also. What to do, sir?
There is a severe dryness is there in the body.
Okay, sir.
So along with that, some neck side black means there is some in excess in the lungs also.
Okay, sir.
Okay. You do one thing. You tonify K7.
K7. Okay,
So
sir.
that it will increases the in energy in the body, and as well as it will take excess water from the lungs.
Okay, sir.
Okay. You
Okay,
do
sir.
K7 tonification 2 times in the period gap of 15 days.
15 days. Okay.
Yes, she will yield greatly. At the same time, avoid spicy, oily, refined foods.
Okay, sir.
Thank you.
Sir, one more thing, sir.
Yes.
Sir, I am having a dry mouth in night only, sir. That is after 9 night, severe dry mouth. I am diabetic.
Okay.
Now it is in control. That is in 208 fasting. But for my sake, it is controlled.
Dryness is more only. Yeah. When you are getting dryness?
After 9.
After 9
severe thirst. I'm
severe.
taking 2 to 3 bottles in the night. Bottles of water in the night.
Okay. You start treatment with ST42 sedation.
Okay, sir.
Thank you.
Thank you very much, sir.
Yes. Next. Sukanya.
Hello, good evening, sir.
Good evening.
I have this, it looks like warts only on the neck,
Only on the neck. Okay.
like this.
Yeah. 1 minute. I will check. I will make you where. Just a minute. Yes. Show me. Yeah. Yeah. It is.
This side also.
Yeah. Sure. It is
And dandruff on the head.
Okay. It's a lung dryness only. You know acupuncture points.
Yes.
Yeah. You just start treating with LU8 tonification.
LU8 tonification.
Apply pepper seed 10 minutes, and after 2 weeks, you can make SP3 tonification.
SP3 tonification after 1 week. So daily LU8.
No, only one time 10 minutes.
Okay, pepper.
So it takes time because of the age also you are in deficiency. Slowly you have to raise the moisture in the skin. At the same time, you avoid some indeficiency foods. Okay.
Okay. Thank you, sir. Thank you.
Yes.
Yes, sir. Sir, am I audible?
Yeah.
Yes, okay. Good evening, sir. Sir, actually, the issue is that I'm having hirsutism problem. I'm a patient of PCOS, a severe one.
Okay.
And from last year, I've seen a very strange growth on my face, on my body. And there are bumps on my face and pimples. And also, I have dark circles. They're very deep-seated also, like hollowness around my eyes also.
What
I've
is your
seen
age?
that. Sir, I'm 23.
23. Okay. Can you switch on the video?
Sure, sir. So maybe it's not visible because of that, but you can say that my hair is also falling and I have pimples and
Okay.
you could say
Pimples are there's large in size, big and swollen there. There is a dampness in body. So you know the meridian points are color something.
no, sir, I don't. Sorry, my perception.
Okay, you do one thing. I will see, okay, you can see my hands.
Yes, sir.
Just a minute. Here, okay, there is a damp heat in the body. Right hand, ring finger, apply yellow color ring. Okay. Yellow color ring, orange color ring on the right hand ring finger, orange color. Okay. Left hand index finger, sky blue color.
मैं आपकी पाँव दिखाऊंगी पापा एक मिनट दिखाओ. Okay, sir.
Thank you. Apply
Sir,
date.
anything for hirsutism also? We have hair problem also, like hair is coming out of our skin. We don't know why. Like
That is
it's a
what
male pattern.
you apply orange and sky blue every daily 2 hours. Okay. After 2 weeks, you share the experience. Based on your feedback, I'll give you next treatment. Okay.
Okay, sir. Thank you.
Thank you.
हेलो
Yes.
हेलो
Yes, madam.
नमस्ते सर, मैं कीर्ति अग्रवाल बोल रही हूँ इंदौर से.
Yes.
सर मेरे फादर के पैर में दिखाना चाह रही थी. उन्हें लिवर स्पॉट होते हैं और पूरी बॉडी में बहुत ज्यादा इच.
Body में what is going on?
हेलो, पूरी बॉडी में इचिंग हो रही है सर.
Okay.
हेलो, पूरी
Yeah.
बॉडी में इचिंग है, पीठ पर और पेट पर और पैर में ज्यादा है.
English, please.
एब्डोमेन और बैक में ज्यादा है.
Abdominal and back.
बैक और पैरों में, लेग्स.
Legs. You can go with stomach 36 tonification.
सर ये देखिए लेग्स.
Just a minute.
liver spot on legs. Only legs.
Okay, it's a black scales. Is there any burning? Only itching.
जलन होती है पापा? नहीं, no, जलन. Only itching.
Only itching. You go with GB40 sedation.
Okay. Methi GB40.
Yeah.
Right.
After
Okay.
2 weeks, you go with the stomach 36 tonification.
Okay. Thank you very much.
That is stomach 36, stomach meridian also.
Okay.
With just 2 points, you can clear it out more than 70%.
Okay. Thank you very much.
Thank you. Vijaya Raj. Soumya.
Sir, can you hear me?
Yes.
So I did consult with you for one of my friend who is suffering from severe psoriasis flare-up.
Okay.
And he hasn't been able to get treated for it even after we did it, because he was addicted to, he had some addictions like drinking and vaping and all that. And I feel like that's triggering him. He was on steroids treatment, and then it was ineffective for a couple of months. He took it. And then now he's been put into immunoblocker therapy from his doctors, but it's still not reducing. And I might have shared some pictures with you before, and I can show the pictures because he's not here. If you can see it.
Yeah, exactly.
Yeah, I don't know if you remember these pictures. These are some of the like issues that he's facing, and heavy itching around his body. Yeah, and his hand is one where it's affected. This one is the most affected area, both hands, and it's spreading around his this section. And sometimes it's weeping eczema too. I don't know if it's called psoriasis or eczema, but it also weeps, like it has a lot of liquid coming out.
Okay.
And recently has stopped smoking and vaping. And I wanted to see if you can provide me some kind of solution for this.
Madam, if it is oozing means I will clear one thing. The liver performance is down. Okay. So if he is taking alcohol and smoking means it's every day it's degrading. Whatever all therapy we put it may works for few days. Again, these things is dominating. So if he is able to perform what we tell, definitely we can help him. But if it is addicted to some of the things, means no one can help in this case.
So he has stopped drinking and vaping. So it's showing improvement, but if there is anything that we can do, should I carry out with the same treatment that you mentioned before?
Yeah,
Or
no, not same treatment. Depending upon your feedback and tongue image and other symptoms, we will change the point.
okay.
Previous
Okay,
class,
sir.
I told very clearly, if already any, not only this patient, any patient oozing is there, means the fluid metabolism is not happening properly. Okay, so to improve that, first function is a liver function. So if anybody smoking and drinking, means daily that liver functioning is degrading with external chemical agents. So whatever point we do that without medicine we are giving, it won't be effective. If already quit, that means definitely I will give you the next point by after this weekend, it will be more effective. Okay.
Sure, sir. I will send the tongue picture and his current pictures as well, what his situation is right now.
He is following all the simple techniques, what we are telling, food and other things, means if he is able to follow, means definitely within 1.5-2 months, he can see the great relief.
Sure, sir. Thank you so much.
Thank you very much.
Vijay Raja.
Yes, Vijay.
Sir. Vijay Raja.
Yeah, tell me, sir.
Sir, for first few years, I will suffer from psoriasis, sir.
Okay.
Last 3 years before, I will take homeopathy treatment from one doctor near my native, sir.
Okay.
At the time, it will be cleared, clear nearly 90%, sir.
Super.
But 1 year before, I will suffering from last lockdown, last April, I will suffer from psoriasis. Suffer from corona, sir.
Okay.
After suffering from corona, again the psoriasis will come, sir.
Okay. Which part of the body?
Both legs, sir. Both legs, both thighs, and back of the body.
Okay. So it is
and some areas in head, sir. Head.
Back side of the head.
Back side of the head.
Okay. So you do one thing, sir. For you, I will give you only 2 colors. You try it for few weeks. So left and right hand. Are you able to see my picture?
So, sir.
Here. Right hand small finger apply purple color. Left hand small finger apply sky blue color.
Right hand.
Right hand small finger below the,
okay,
below the nail, purple color.
Which finger, sir?
Right hand small finger, which I am showing you.
Okay, sir. Okay, sir. Right hand small finger.
Purple color. Left hand
purple
small
color.
finger.
Okay, sir.
Left hand small finger, sky blue color.
Sky blue. Okay, sir.
Just below the
sky
nail,
blue.
apply a small line here.
Okay, sir. Okay, sir. Okay, sir.
Daily apply for after 2 hours, erase it completely.
Okay.
Apply it for 3 to 4 weeks. You can see the great improvement.
Sir.
Sure. Thank you.
Very. Okay, sir.
Namaskaram.
Good evening, sir.
Thank you, sir. Thank you very much.
Thank you. Good evening.
सर मेरी नोज पे पिगमेंटेशन है लास्ट 3 इयर्स से.
Okay.
सर ये विजिबल है?
1 minute. Yes.
And सर यहाँ पे भी इस एरिया में भी थोड़ा सा.
Yes. What is your age?
47.
Since how long it is there?
3 years back.
Okay, it's due to dryness inducing in the body. You can go with LI4 sedation.
Only one time, sir?
One time you do it. After 3 weeks, you do LI11 sedation.
Okay, sir.
Okay. So after that, you give me the feedback for next point. Okay. Thank you.
Okay. Thank you, sir.
Ready. Shiga. Shirish Kumar. Shirish Kumar. Usha.
Sir, my sister,
Hmm.
62 years,
Hmm.
she is having this hypothyroidism also.
Okay.
From past 1 year,
Hmm.
she is getting eruptions on her head, particularly GV20 area.
Okay. What do
And she will, sir.
okay, eruptions with hypothyroid. Okay.
And she will have a lot of itching, pain, and after putting oil, massaging, it comes down. And after 5 days or 10 days, again it comes back.
Which oil she
And
put?
coconut and castor oil.
Castor oil. Okay. After
Yes.
putting castor oil, it is coming down means there is a heat.
Yes.
You can go with liver 3 sedation, madam.
Okay, and insomnia problem is also there.
Yeah, that will also addressed with that point.
Only one.
Yeah, 1 point. Only one point.
Okay, sir. Thank you.
Thank you.
Hello.
Hello.
Hello, sir.
Yes, tell me.
Sir, मेरे को ना I am suffering from hirsutism. Hello.
Hello. You just avoid multiple talking. You can mute all. Yeah, now you can mute yourself. You can unmute, madam.
हेलो सर
Yeah, tell me.
सर ये क्रैक्स और ड्राइनेस है फिंगर्स में मेरी डॉटर इन लोग को मैं बताना चाहती हूँ इसमें तो 1 मिनट में बता रही हूँ ड्राइनेस क्रैक है सब ब्लीडिंग भी होता है एवरी विंटर में हाथ पूरे फट जाते हैं और ब्लीडिंग होती है
Okay, what is the age of the patient?
32
42. Okay, see.
32
32. Oh, it's a,
और के हड्डी गिरा भी होता है
you do only one time you do SP3 touch.
SP3 टच मींस खाली टच करना है
Just touch SP3 with the right hand index finger tip only 10 to 15 seconds. You do that within week or 10 days, it will clear.
Okay.
Thank you.
गुड इवनिंग सर
Good evening.
सर आपने सीवियर सोरायसिस के लिए मेरे लिए एक ट्रीटमेंट किया था सर उससे काफी अच्छा रहा लेकिन कई बार इचिंग जो है अलग अलग जगह होती है जैसे बैक हेड में शोल्डर पे हिप पे या ईयर पर ये ऐसा क्यों होता है सर
Okay, shoulder, hip and ear.
ईयर मतलब GB 2019 पर ईयर पर बैक शोल्डर पर
Okay, once you do SI4 sedation.
SI4 sedation.
Yes.
Okay, thank you sir.
Thank you.
सर टच मींस खाली टच करना है कुछ दाना कुछ नहीं लगाना है
Nothing, only touch.
और व्योल पे
Yes.
थैंक यू सो मच
So thank you very much. See you next week. Next Thursday, we will continue our psoriasis class. And today we covered only one topic about blood heat. A few more regions are there for psoriasis. So we will discuss in depth and we will also give consultation to the patients. Thank you very much.
Last question, can you take, sir?
Yeah,
Last question.
I have one more meeting. One more question is Ken. Yes.
Okay, sir. So my brother, 21 years old, he is having black scales on his face large pores are there on his cheeks. He is also having oily skin, and his face looks very dull.
Okay, you do one thing. H7 sedation.
Can I show him, sir?
Yeah, it's very good.
Okay.
Nothing is, yeah. Yeah, there is a black. Yes, there is no much heat in the body. Okay, there's black scaling and all. You can make him bright skin and glow with the H7 sedation. Clear,
Okay, sir.
Pooja? You
Methi
just
seed.
apply one methi seed
Yes,
on
sir, yes.
7 and give me feedback after 2 weeks.
Okay, sir.
Sir,
Thank you, sir.
SP3 touch on anyone of the hand touch.
Anyone the end.
Okay, thank you.
Thank you very much. Thank you, Joshi sir, and thank you, Ridan.
Kumar.
Yes.
Hriday Kumar. Yeah, hi.
Yeah, good evening, sir.
Good evening, sir.
So thanks a lot for this very informative session on psoriasis. This is really helpful for us.
Definitely, sir. We will continue our series of sessions because lot more things, small triggerings will be there for psoriasis. If you learn in depth how they are acting on the body and skin, definitely people will avoid that.
One more thing, sir. Is there any universal point that we can advise to our group members, like for the plaque psoriasis?
Plaque psoriasis. Okay, plaque psoriasis is due to blood deficiency. Okay. So the only thing is they should improve their fluids in the body. To make it that they can add some dry grapes and cucumber and any one fruit in the afternoon meal. Plus avoid the spices, ginger, pepper, garlic and cinnamon kind of things in this one. Plus to make it that skin moisture, maybe week or 2 weeks once. Okay, they can touch the first line of index finger end. Okay, with their right hand index finger, just give a touch how I am giving now. Just to 10 seconds. Okay, even just below that skin also, below this line also fine. If you touch like this for 10 to 15 seconds, okay, it improves the moisture in the skin. The scaling will come down. But only you should not do when you have coldness. There already nose block is there, cold is there, chillness is there, and foot and palm is already cold. That time don't do. Otherwise, once in 2 weeks, you just give touch below this line, like this, how I am showing. Okay, just 10 to 15 seconds. It is greatly improves your skin moisture. And over the period of 6 months, your skin scaling will come down more than 70 to 80%.
Very good, sir.
Okay, but before touching that point, you should obey the condition. The nowhere chillness, coldness, nose block should not be there. Okay, then you can touch.
And this needs to be done once in 2 weeks.
Yes, that's it. Only 10 seconds. Okay. Sure.
So this is only for psoriasis or any other dry condition also. For example, dry eczema.
It may be dry eczema, scaling, and dry skin, dry foot, cracks in the foot. All are conditioned to the it's a scaling only.
Okay, sir.
This is the point to moisten your skin.
Right, sir. Only about 10 to 50 seconds. How wonderful, sir.
Yeah, 10 to 12 seconds is enough.
My good God, how it can work so fast.
Works superbly. You can give feedback after 2-3 weeks in the Joshi Keda group.
Sure, sir, definitely.
Sure.
Very good.
Hello,
sir.
Thank you.
Hello, sir.
Yes.
LU7,
Sir, Sir,
It is LU7, LU8 and LU9 all together comes. I'm just
Oh.
giving a touch.
Okay.
Okay, thank you. Yes,
Thank
just
you.
one touch, it will make you great healing in the body. And in the upcoming week, we will do lot more
Right
research.
hand
Yes, sir.
index
Thank
finger
you.
to touch.
Yeah, left hand index finger.
Sir,
Okay.
Sir,
Thank you.
Sir. Hello. Hello, sir. Hello.
You can.
Hello, sir.
We will inform you the next section again. At that time, you can ask. Now the sir had another meeting. So actually, he has given only up to 9 o'clock. So we can meet again on the next class. Thank you. Good
Joshi
night.
sir, thank you very much.
Okay, thank you. Welcome.
How are you?
Fine, fine,
Nice
sir.
to hear your voice after a long time.
Joshi sir,
In the
thank you.
program.
Fadnavis here.
Okay.
Fadnavis here.
Thank you, sir. Good night.
Thank you, sir.
Thank you. Thank you for active participation.
Thank you, sir.
Welcome.
Thank you, sir. Good night.
Thank you, sir.
Thank you,
Okay,
sir.
welcome.
Joshi, sir. Thank you very much.
Welcome.
Vijay Kumar.
Okay, Vijay. Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you so much.
Okay, welcome.
Thank you, sir. Geeta.
Thank you, Geeta.
Welcome.